Lovely to be with you all here today from Galway in the west of Ireland. I am a clinical psychologist based here in Cancer Care West, which is a community-based support centre for those affected by cancer here in the West. And I've developed a children and family service over the last few years. And I suppose also as part of my work more recently, I'm here to represent Childhood Cancer Ireland, of which Mary Claire, a moderator, is the director of the service. And just a little bit about Childhood Cancer Ireland. It was established 10 years ago, and it's a national parent and support survivor-led charity. We provide practical and emotional support for families, and we campaign for better support and services for families and survivors. Childhood Cancer Ireland offers a full range of supports, I suppose, looking at the existing needs and known gap in needs in services here in Ireland, and looking to fill those needs, but also to campaign at a national level for those needs to be met for families. So some of the supports that are offered within the service are a parent peer-to-peer support program, a nationwide play therapy and parental advice program, a Beads of Courage and sibling program, supporting parents, survivors and clinicians participating in national and international conferences and events, or Gold Ribbon Conversations, which is our podcast that uses the power of conversation to explore and increase awareness of childhood cancer, educational webinars, self-advocacy workshops for parents and adults and adolescents and young adults here in Ireland, refurbishment of paediatric oncology rooms and treatment rooms across the country. And I suppose with that, striving to find new and more supports to meet the needs of families. Our parent workshop has been developed and run nationwide in 2023, with more development and services to be rolled out next year. So onwards and upwards. So for today, for this session, I want to explore the impact of childhood cancer diagnosis on the whole family unit and how families adjust and adapt with a focus on helpful strategies and the importance of self-care and peer support. And I know it has been the threads that have run through all the wonderful talks here this afternoon. And so hopefully even some of this will be consolidated in this talk. So takeaways from this presentation is that normalizing of the emotional experience of families, because I think often, one thing that we can do is almost that judgment that someone talked about earlier around what's wrong with me? Why am I this way? And we almost get caught up in the trying to think about it or rationalize it rather than experiencing and understanding the normality of the emotional experience that you're having as a family. Also, you want to highlight your existing resilience, those things that you have in place that maybe you haven't paid attention to or recognized as your coping strategies. And maybe some that haven't been in place for a while, but you want to bring them back on board. And also maybe sharing more useful strategies that might help also. And one that is always dear to my heart is the importance of self-care for a parent. So to look forward, I think it is important to also look back. And I often hear of parents talking about trying to figure out what has happened or where they go from here. And it almost feels like a tornado that's coming through your house. And at that time that we're in the middle of a tornado, it's not that we can possibly even think or even emotionally experience it. We're actually just kicking into survival mode, where our stress response is activated and we're moving and acting, trying to stay going through the experience. And it's only afterwards, maybe, that we have time to even emotionally experience what has happened and to adjust and adapt to the experience. And sometimes you're looking at maybe when is the next tornado arriving, or maybe if you've experienced a recurrence or progression within your family, that it feels that the tornado has never left and you're trying to live as well as can be within that experience. In treatment, it's a whole family experience, as we know. Each of the other speakers has already spoken to that. That's the parent aspect of all those maybe emotional and psychological and physical experience that they're having that may be presenting with symptoms of anxiety or depression or post-traumatic stress response. So it can be something that impacts you at your own level. It also can impact siblings, and we see a lot of research in the last few years around this. How maybe during the experience, the siblings, the focus is naturally on the patient, but the siblings are also across many of their domains. Research would tell us that across each of their settings, from school to home, through peers, that it has had an impact on them. And up to 63% of siblings can have adjustment difficulties to the cancer diagnosis and treatment of their sibling. We also know that they experience a whole range of emotions, not only worry for their sibling, but maybe also some level of jealousy around the attention that's given to their sibling. Not that they don't understand it, but they're missing maybe the attention or the way that their family has been and the impact on that from their pediatrics perspective. We also find that parents maybe are challenged in their parenting approach, having a different parenting approach maybe for the patient than for siblings, and how maybe that causes conflict for siblings and for them to find it difficult to understand. And maybe also at times for parents to knowing that their parenting approach to the patient has changed, trying to find a balance so that there is some level of feeling that they are, and the word that comes to mind and is often used is, I don't want to overindulge them. I don't want to maybe set them up that they have this expectation around the parenting approach that I'm using right now. So they really have, parents have a conflict around that and how maybe they feel that they don't have the confidence around which approach to use at a particular time. I wonder if any of you recognize this in yourselves, that idea of the plate spinning, all those different demands that are coming towards you. You have the patient's medical and emotional needs, interacting with the team and all the different medical terminology, other children's needs within the family, financial needs or stressors, work-related demands and how they are supported, and the partnership, how your partnership may be impacted by the diagnosis and the focus on the demands of the family. And I suppose it is with intention that I put self at the bottom of this list, because you may find, and often parents find, that their needs don't ever get met, that they never feel that they have the time or capacity to look after self. And often we hear that maybe even their own medical needs are put to the side at the time, or even their own emotional experience. They're trying to keep all the plates spinning, and they feel that they need to push their own emotional experience to the side. And as we know with lists, and when lists are really, really long, we don't often get to that end of that list, and some of those later items often get missed. And I suppose I'll talk a little bit more to that at the end of the talk, around the fact that the importance of that self-care aspect as well, of looking after self. This is looking directly at parents. So the relationship and how there's stressful issues that are maybe across genders, across parents, but also there's some differences as well. But overall, we will hear that at least 50% of parents find that their partnership has been impacted, because there's not that time to maybe focus on that partnership and that intimacy. And you'll see from some of these stressors that are both similar and different across parents, that lack of intimacy is one that comes, that there is quite a difference between fathers and mothers, with fathers having more, seeing that more of a stressor for them. or being away from work is more of a stressor for them. While the mother is feeling more of a helping child's siblings and not being able to be there for them as difficult for them. And we often hear as well, and some of the research would tell us, in that space of not having capacity to maybe strengthen a relationship and have that intimacy, that sexual intimacy may be put to the side. And something that may be of value to you and is impacted, and something that if you recognize as something that's impacted and something that is important for you to come back online with, that there's space given to talking and thinking around this. Finishing treatment often comes with a range of feelings, and I think it's very important to name that. That if you're finishing treatment, that everyone may say to you, isn't this absolutely amazing? Everything is great now, right now. You must be absolutely excited and you must be relieved. And I think it's already been spoken to in other talks around that dichotomy, that you can have both feelings, that there you may notice some of those things that have been impacted within the family unit, such as relationship strains. There's uncertainty about the future. There's fear of recurrence, as well as that relief and excitement. And that's normal, and not to feel that you can't be holding both. Some families would say it's almost like a new norm. It's not that you've returned to normal, like other people may say to you, but it is around that new normal, how you as a family unit adapt and adjust and move forward. Sometimes people say it's almost like a roller coaster of different emotions of different times, so each family member feeling it at a different time and experiencing it in a different way. And that's important, that we're patient with each other and recognize that no one's doing it right or wrong. We're all maybe doing it a little differently. Some people would refer to it as falling off a cliff, that they have medical appointments less often, or maybe that they feel that uncertainty and worry around not being maybe held by the medical team as often as they did. And some would refer to it as living with a shadow, of learning to manage the vigilance that people talked about earlier, how our system is in that hypervigilance state and how we maybe learn to manage that over time. And also when treatment ends at a particular time, that we need to maybe look at seeing that as a starting point for recovery of the family rather than an end point. And that is something that even, at a time where some families are facing into recurrence, are facing into a difficult prognosis, that those moments of recovery, even at a personal level of having that self-care and taking those moments, are very, very important to almost recharge your battery, or as Joe spoke to, those spoons, how we can recharge those spoons and regain those spoons. And also to name that treatment decisions and how that can be so difficult, especially around different treatments, oncology treatments, but also clinical trials, and how that brings up so many different emotions for us. There's that decision fatigue that's often happening because of all the different decisions that you need to make at that point, where stress levels are so high that our ability to make those decisions are really difficult. We also may face tensions within the family of different people having different opinions or different decision processes, and how we manage that. There also may be that feeling of how am I going to make the right decisions. A parent, being a good parent, can be associated with making the right decision, and how challenging that is in that terrain to be able to choose which one is best for you and your family. I mentioned around different decision-making processes or different opinions, and maybe sometimes opinions from outside the family or the extended family that are given with the best of intention, but how stressful that can be when you're being maybe bombarded with different clinical trial opportunities, or opinions given by extended family members, and almost that idea of, this is another option. Are you not trying to look for it? What, how do you feel about it? When you're already bombarded with so many decisions to make, and these communications are sometimes very unhelpful, and parents often feel that they are, again, going back to making the right decision for their family. If other people are presenting it, why aren't they thinking about it? Why are they not researching it more? The what ifs, the whys, the regrets. So it can be an absolute roller coaster and very tense and difficult time, and very difficult time to which we make decisions for yourself and your family. But I think it's very important that we really name that idea of making a decision that is right for your family, irrespective of how others' opinions may be coming into the mix. What they say within the research is, if we can almost take an attitude of no regrets when you make a decision, which is a very difficult thing to do, but it is around maybe using some of these decision-making processes to help you make a decision at a time that you can say, I made the best decision for my family at a particular time, and to look back at a later stage with regret is unhelpful. And when you have more information at hand at a later stage, it is really a luxury in that it wasn't part of your decision-making process at the time. How could you have known that information if you didn't have it at hand at the time? And so it really is about feeling certain yourself that when I've made this decision, I've made it to the best of my ability with the information and support that I have at hand at this time. So some of the things that can be helpful in that decision-making process is giving time, and that's not always available to you due to the treatment demands or the availability of the clinical trials. But if any time can be given, that is ideal, so that you can have time to think about it, to think about your individual preferences for you and for your family. What are the needs of the family? A decision for one family around a clinical trial might be completely different to another family, and it's to know and respect your individual family's values and needs. Communication, that is clear communication with the team, so that you're making an informed decision for yourself. And obviously time is helpful in that. Clear information from your team, and also feeling that you can go back and you can ask more questions, that you don't feel hurried, that you feel that you've enough information, that you know that even if you have been given an answer and it doesn't feel clear enough for you, or you don't feel certain, that you can go back and ask for more. Support also is very, very important. The support that you need from the team, you need from family, you need maybe from other professional support services, that psychosocial support, maybe through social workers, to help you to have that, ability and to reduce your stress levels to a place where you can actually make a clear decision for you. And also seeing what part the patient can have according to ability. So really is ability dependent. What level of involvement can they have in making that decision around their treatment and clinical trials? And often parents ask me, or have maybe a resistance to engaging in palliative care, and thinking that maybe it's not time just yet for us. And I suppose it is important to name that it's not synonymous with end of life. So I often hear families saying, just not yet. But it is really to say that early involvement is key for patients with high-risk cancer diagnosis. So very important, so that you can get the level of support that's important for your family. What it can really do is that it can help you to improve outcomes for symptom management and for quality of life for patients and family members. So it's not that it's either or, that you have cancer-directed care or palliative care, that they go in unison together. And that is about building up that relationship with the team so that they're at hand when you need them. And I suppose just even to lean into the research, that what it tells us is that A lot of times, when 50% of the times that patients and families engage with palliative care, the ideal time to do that is when they still feel that the plan for care is cure. That it doesn't mean that you have to feel that it is entering a new stage of end of life. If it's made available to you, do engage with them and start building a relationship with them. So again, just looking at what's available and what's identified needs in palliative care. And I suppose this is a consolidation of opinions from parents, from patients, and from clinical providers. So from healthcare professionals. Or what are the identified needs for families within palliative care? It is that communication, to get that building up of a rapport, and to being able to be for the team to be available to all members of the family, so everybody's voice is being heard and everybody is being cared for. Symptom management is an important part of that, to be able to learn to understand how best to measure and track symptoms for the patient and being able to attend to their needs as they arise. Also, another role of palliative care is around cognitive understanding, helping all members of the family to understand where things are and how everyone is. Because I think often and it's meeting the patient where they're at and meeting every member of the family. No palliative care team is going to introduce a topic that someone is not able to take on board. And I suppose that's the important part of it, is that there is that space for all family members, and that it's taken at the level and need of communication and understanding for each family member. Other needs, such as physical or financial needs, will be addressed through the team as well, and also at helping maintaining relationships, that the role of the palliative care team being the carers and medical carers for the patient. And so relationships as siblings and parents and child relationships can be maintained also. Resilience is spoken about already, and I suppose it really is about that resilience of how we bounce forward, or bounce forward rather than bounce back, in terms of our family in adversity. And a lot of research would say that family resilience is something that we can build together. That's really, really important for us to build together. And some of the things that are under each of these different aspects of family resilience within the oncology setting is that belief system of how maybe we have shared belief systems, that how our spirituality is in unison, or how it supports us as a family, how our outlook might be in unison, and how we share our emotional expression of things that are happening for us as a family. Another aspect of that is communication and problem solving, how we are open and clear in our communication with each other, that we're sharing, that we're journeying together, that it is as a family that we are facing and living and recovering from adversity. Organizational patterns is that flexibility within the family, how we're flexible to each other's needs and respect and understand. We maybe all experience it differently, how with patience and understanding that we support each other irrespective of our different coping styles and our different opinions and emotional expressions. And also what other maybe external supports and resources are available to us, whether it be external supports, both professional and personal, and maybe also some other resources in terms of financial resources can also be helpful. And with our resilience, and you may know some of the aspects of your family, that coping strategies that you have used, and hopefully this has maybe validated some of those along this talk here this evening. But also looking at, it is never too late. It's planting seeds of looking back with your family. When we spoke about maybe the siblings' experience, when we spoke about your experience as a parent, your experience as a partner. It's about how maybe we can look back at those different things, of things that went well and didn't go well. Because when we're making meaning of adversity as a family and looking at that, open and clear communication, emotional expression, it's looking at how in that time, things that went well for us or things that didn't go well. So that we're leaning into things that work well for us as a family, but also looking at things that didn't go well, so we can look at making repairs for those, or bringing those forwards, or putting new strategies in place that can help us do that. Because I think it's really important that sometimes we feel that we can't look back, that we don't want to bring up create a feeling or create a memory. But what we find is that doesn't happen. We don't create it, we maybe give space to it. It's already there. And so we're giving space to it. So the take-home message would be that when we're communicating, we're looking at visiting and revisiting maybe some of those difficult moments together. And you can see in this picture that they're not looking at each other. As we say, no eyeballing, because it's very difficult to talk and maybe to share how we're feeling if we're looking directly at each other. So really that if we're doing an activity, sometimes they're in the back of the car and you're driving. Sometimes we're going for a walk. Sometimes play can be a very natural way in which us connect our emotions. So it's having that space where you're dipping into what was it like for you. So finding little micro moments where you're planting little seeds and is giving a young person, whether it be the sibling or patient, a space to maybe come back later to how they were feeling or what they were thinking. So it's planting seeds to go, I'm open and available to have these conversations. So you can use prompts like, remember when? Name a feeling such as, and be very honest, I am or was worried or angry or sad. And then ask them, what was it like for you? And sometimes it's about validating. It's not about fixing it. Well, it's often not about fixing it. And I think sometimes as parents, we go into fixing mode, that if we reveal a difficult feeling, that we need to fix it then to make it better. But really what they want is that space to share how they're feeling. So letting them know that it was very difficult for them. Encourage them by telling them that you're glad that you shared. Highlighting their strengths, the things that went well, because often, as we say, we focus on the things that are not going well, but it's also important to name those things that went well. And then invite further conversation also. So it's maybe saying something like, that was really difficult for you. I'm glad that you shared, and I'm happy for us to chat again anytime. You're welcome to bring it up, but not to fix it, go into fixing mode. And also to know your own capacity. Maybe you're not able to have those conversations. Maybe it's somebody else is having those conversations. So self-care is about caring for you. And I think it's a very important thing for us to finish up on. Caring for you so that you can take care of all the family. And if we look back at that analogy around a tornado coming through the house, and the house has been impacted, you as a parent are the foundation of your house and of your family. So caring for you means that caring for everybody else. Back against the analogy of the tornado, it is a necessary skill that our parasympathetic nervous system, our nervous system is activated, so our sympathetic nervous system, that fight or flight response, kicks into action. And we almost have to learn to rebalance our nervous system, to able to turn back on our parasympathetic nervous system when we have the time or when we have a moment to do so. And that really is a relearning when you've had to be hypervigilant, have to be hypervigilant a lot of the time. And it is about rebalancing our system, and that keeps us in the best space for well-being. If we can recharge our battery so that we can cope well. Self-care, not to put an extra demand on you, but it is maybe about doing small little steps. Because I hear parents say all the time, Don't ask me to do any more. I'm already have all those plates spinning. So know that self-care and the basis of self-care are very small changes, little steps of eating well. Am I making sure I'm having breakfast? Am I hydrating? Am I being active? Am I getting out for a walk or some fresh air? Am I getting sleep? Enough sleep? Healthy sleep? Can I go to bed 10 minutes earlier? Can I take naps? How can I make this happen for myself? Just a little bit, even if I made one little change this week, what would it be? How do you reduce your stress? Is there time for you? And is there time to reach out to others? There's so many supports within your own region, and I suppose it's important for you to maybe know who they are and where they are and to link into them. These can be peer or professional led, individual or group, for all family members. And it may not be therapeutic groups, it may be gentle activity based. And just to know that it can be really helpful in reducing isolation for every member of the family, normalizing the experience, and offering you empowerment by helping you to recognize the coping strategies and capacities that you have, and knowing that the support is there. And I would encourage you all, if you haven't already, to link into local supports, because sometimes it's knowing that they're there and that you may not use them right then, but knowing that they can be available to you at a different time if needed. So again, just to conclude, we explored the impact of a childhood cancer diagnosis in the family unit and how families adjust and adapt with a focus on helpful strategies and the importance of self-care and peer support. So I'm hoping your takeaways from today is normalizing emotional experience for families, highlighting existing resilience and sharing useful strategies, and the importance of self-care and support. Thank you very much, everyone.